As you all know, on Saturday, there was a hostage situation here at the detention center that ended in the death of inmate Curtis Williams. The majority of the significant challenges here at the detention center are really the result of two things: insufficient staffing and infrastructure, or the actual physical plant challenges that we have. We've been facing staff shortages since we took over. Just recently, we have widened our opportunities to recruit staff. We've implemented a pay increase that we think will help us draw a better candidate. In fact, we have been able to recruit and hire about 35 additional staff since the pay raise that went into effect last month.
Yesterday, you all may be aware, the State Department of Health did an annual inspection. They were out here February 5th, I believe. We have just received the report yesterday. So as we continue to review that report, we will respond accordingly.
It did point out some things that we do have some site checks that we don't make. Sometimes the food on occasion is late being delivered. And again, those things can be directly related to insufficient staff or shortages of staff. The infrastructure, of course, everyone has known about, or most everyone has known about for a long, long time. The building really is poorly built and poorly maintained for years and years. We have made quite an effort since July to improve that. In fact, we have made a lot of improvement since July.
In 2017, we brought in a national organization called the Vera Institute for Justice that did a deep look at the problems we had and made a report. The Vera report also identified things that in this criminal justice discussion you all are aware of: problems with mental health, substance abuse, a high number of municipal violations that were in the county jail, and then generally the conversation about the negative conditions in the jail with physical infrastructure. The building's 30 years old. It has not been maintained well, and it was built for 1,200 people, and it's been serving more than 2,500 at a time.
When we took over, of course, the detainees were spending very little time outside of their cell. When I say that, I mean that gives them an opportunity to do video visitation, to take showers, to do recreation, to do those kind of activities. And we have increased that at least 20% since we took over in July. A lot of the things that are mentioned or that I see in the media relates to canteen, commissary, medical services, the phone systems. Those are all contracted services, and we continue to meet with those providers at least monthly, and we are holding them accountable, and we have ongoing conversations with them about bettering those services.